Hi guys, I'm Dr. Santhosh Jacob. I'm an orthopedic surgeon and today I will be talking about how you can manage your pain during this COVID-19 crisis. So first, if you have an acute injury is if you have fallen or the pain is something which has happened only recently, then I advise you to do the RICH regimen. So what is the RICH regimen? R stands for rest, I stands for icing, C stands for compression, tying a bandage around the injured area, that is compression, and H stands for heat. So when you alternate ice and heat, rest the wound and bandage it, automatically inflammation in that area will reduce. Always do not apply ice directly, but have a thick cloth or a towel in between ice and your skin. Otherwise, you might get frozen burns. Even with heat, do not use a towel which is too hot. Let it be moderately warm, because when there is a moderate change in temperature, there is an increase in circulation, and as all of you know, an increase in circulation increases healing. Then apart from this, if you have a lot of pain, you can take a tablet paracetamol quite safely, but if you can, call your doctor and find out the dosage. Another advice is, if you're taking any medication at all during this time, take a pan 40, something to protect your stomach, along with a probiotic like lactobacillus. You can also use ointments which heat your skin or chill down your skin. Basically, that is a counter irritant. It irritates your skin, and because of that irritation of the skin, you will not feel the pain. So it has no complications and you can use it. Just make sure that there are no open wounds on the skin, because then it will increase your inflammation and cause more pain. And if you're someone who has chronic pain, for example like osteoarthritis for the last few years or rheumatoid arthritis, and you have been taking prescriptions from your doctor, do not stop. Continue the prescriptions. Just a few tips. If you're somebody who is on a skin patch, always remember that when you have fever, absorption of the medication increases. So if you're febrile or you have a fever, remove the patch and ask your doctor for an alternative. And also those who are on opioids, remember opioids can cause respiratory depression, that is breathing difficulty. So in this time when we have a respiratory virus, avoiding it unless it is necessary could be a good idea. Again, coming to NSAIDs, they have advised to use it judiciously. So if you have severe pain, you can take a diclofenac or an ibuprofen. Yes, there are studies which show that it increases susceptibility to infection, and there are also studies which show it doesn't. So use it when you need it on just an SOS basis. A word about steroids. It has been very clearly advised that it is better to stop using steroids at this point of time unless you are somebody who has been using it for a long time. If so, call your doctor and ask for his advice. Do not change any medication which you have been taking for a long period of time suddenly during this lockdown. General advice on what are the supplements you can safely take in order to prevent any body pain from happening. So generally I advise vitamin D3 every week. It is available in a form of a sachet which can be mixed and had. Vitamin C is extremely important as it helps in synthesis of collagen. Collagen is there in muscle, ligaments, bones, and everything which helps us move. So collagen will help in regeneration of those tissues and early recovery. Vitamin B12. If you're somebody who has nerve pain or back pain, B12 750 mcg every day is very good. It is available as methylcobalamin. Apart from this, any good supplement which has zinc, manganese and calcium should also be added. Tablet collagen is a supplement which is very useful for recovery of your muscles and soft tissues. So you can even add collagen to your daily routine of pills. Cissus quadrangularis and curcumin. Okay, these are dietary supplements which are available in the form of pills, okay, which you can take in order for your soft tissue to regenerate, joints to heal, reduction of inflammation in the muscles. This also helps in reduction of pain quite naturally. Remember one thing, whatever supplements you take, they work in your body for a day. When they stay in your body for longer, they become toxins. So always drink a lot of water. I would advise, if you do not have a renal issue or any other problem for which you should reduce your water intake, take 3500 ml of water a day. Also take electrolyte supplements as it is getting hotter day by day. Being hydrated is one of the ways we can make sure that our immunity which is inside us is taken to all parts of our body through our circulation. Finally, coming to interventional options, intra-articular injection of steroids, that is, if you have acute pain, injection of steroids into the joint has not been advised. They have asked us to avoid those injections. So what are your options? If you're somebody who has mild to moderate pain in the knee, shoulder, heel pain, plantar fasciitis, you can ask your doctor about PRP or platelet-rich plasma. Basically, PRP is something which we harvest from your own blood. It has concentrated blood products and it has a lot of growth factors and healing cells. When those are injected into inflamed regions, it naturally reduces the inflammation. That is an option if you have an early problem which is quite mild, and if it's a serious issue, for example, if you were somebody who was expecting a surgery to take care of your pain, then more advanced interventional orthopedic procedures which do not cut the skin, like stem cell infusion into your joints, very effective in knee osteoarthritis and hip osteoarthritis. Also, if you have disc pain, it is very effective. This can be done. Talk to your orthopedic surgeon about it and they will be able to tell you what exactly is best for you. But remember, you have options. You don't have to struggle and live with the pain. Let us be informed about everything we can do to protect ourselves and keep our community safe. Be home, be safe, be well. Information is the best vaccine against any disease. Dr. Santhosh Jacob.